Hello, my name is Dr. Ron Remick, for those of you who don't know me. I'm the medical director of the psychiatric clinics here at the Mood Disorder Association. And I want to discuss with you a new and exciting treatment that we are now offering here at the MDA called Transcranial Magnetic Stimulation, Repetitive Transcranial Magnetic Stimulation, or rTMS is what it's called. We're very excited to offer this program. In fact, it's the first public offering of TMS here in British Columbia. There is another program in British Columbia, but it is really only for research patients. So we are going to be offering this program for people with any type of chronic depression. It is a non-invasive, what we call neurostimulation type of treatment. We use, or what is used, and we're going to show you a video later on about the specific machine that's used. We use the properties of electromagnetism to generate a magnetic field, and that stimulates certain brain centers, that stimulates certain cells in the brain. And we have found, and research has shown, this is quite effective at improving the symptoms in people with depression. If you think about it, what we're stimulating are very similar areas that are stimulated when we give someone an antidepressant and they get better. And actually some of the things that happen when people do psychotherapy, certain brain areas are stimulated and people improve when they get psychotherapy for their depression. TMS, transcranial magnetic stimulation, is actually a very short treatment. It's an outpatient treatment. You don't have any kind of anesthetic for it, and it takes about 3 minutes. We will be doing TMS. Most people will need the treatment for either 4 or 6 weeks, and that's every day or every weekday for 4 weeks or for 6 weeks to get better with TMS. Again, if you think about it, that's not much different than if you take an antidepressant for depression. Typically takes about 4 to 6 weeks to get better. All patients who are interested will have an assessment with one of our new psychiatrists, Dr. Fidel Villa-Rodriguez. Dr. Villa-Rodriguez runs the research neurostimulation program at UBC, and we're thrilled to have him as part of our MDA staff, where he will be offering this treatment to the community, to the public. So everyone will have an individual assessment with Dr. Villa-Rodriguez, where he will explain a bit more about the procedure and make sure that you are an appropriate candidate. So if you decide to do TMS, what will actually happen is you will come here daily for those 4 weeks or 6 weeks. You'll be here about 15 minutes. You'll check in. You'll have the treatment, which we'll show you a bit about later on in this video, which lasts about 3 minutes, and then you'll go about your day. As I say, there's no anesthetic. There are pretty minimal side effects, which I'll say something about. You can drive a car to and from the appointment. You can eat and drink before and after the appointment. The only significant side effect that really a small minority of people have is they may have a mild headache for an hour or two after the program. Usually it goes away on your own, but there's no reason you couldn't take an aspirin or a Tylenol if you felt that that would help it more. That's a minority. The only people who actually cannot or would be excluded from having TMS if they had depression are those people who also have the neurological disorder called epilepsy. We would consider that would be an illness where you can't have it. The other one is if you've had some kind of injury or neurological problem where you have metal in your head. If you've been in the war and you have shrapnel in your head or have some kind of metal plate, metal and magnets don't work very well together, so that would be the only other reason that you couldn't do that. People often ask, well, how is this different from ECT, electroconvulsive therapy, shock treatment? While they both are stimulating the brain, the biggest differences are ECT does require a general anesthetic, so it is a much more significant intervention. And ECT can have significant side effects, particularly problems with your memory after the ECT. There's been lots of research, and there really is no memory problems associated with the use of TMS. How effective is TMS? Well, there's a lot of research now that would suggest that people who have treatment-resistant depression, refractory depression, that means they have tried 2 different treatments for depression, either a psychotherapy or a medicine, or 2 psychotherapies or 2 types of medicine, and aren't getting better. That's what we call refractory or treatment-resistant depression. In lots of groups of these refractory depressives, about 50% get better with TMS. So if you have a chronic depression, a refractory depression, certainly this is a treatment that you should be thinking about. And so we're very, very excited to be really the first ones in British Columbia to offer this type of treatment for all of our patients, all of our consumers here at MDA.
This box here is the neurostimulator itself. This part of the device has a computer, and is the part that generates electrical current that goes through these cables to this part. This plastic shell has a lot of wires inside, and this is what we call the coil. So when current circulates through the wires in a pulsating way, it generates an electric, a magnetic field. And that magnetic field, when it finds a conductor like a brain, generates an electric current inside. So for depression, roughly, I know by heart now that my dorsolateral prefrontal cortex is around this area. So we place the coil here and we let it sit there for the duration of the treatment. This part here helps us to determine exactly where to put the coil and target specifically the area of the brain that we want. So now you're going to be able to hear the newer treatment, the theta burst stimulation. And again, we don't need to wear ear protection because we're going to use a low level of energy. And 1, 2, 3. For theta burst, we use cycles of 2 seconds stimulating and 8 seconds off. And we do this, we repeat this process 20 times. So that's why it only takes 3 minutes to go through this simulation. But the theta burst, what it is it packs stimulations in bursts of 3 stimulations. So that's what you are hearing, this trat, 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 trat. Whereas the conventional, it's not a patterned type of stimulation. It's just a fixed frequency of stimulation. You're going to hear it again, and you're going to notice the difference right away. And there we are. So you can clearly hear the individual pulses at a fixed rate, whereas the other one is more the bursts that you hear.